Welcome. I hope you had a nice lunch. My name is Ann Anderson, and I'll be your moderator for this session. And I'm also the chair of the CUGH subcommittee on enabling systems. So I guess that means that whatever comes out of our track for the enabling systems will be my responsibility to move ahead along with the leadership of CUGH to see where we end up with the feedback that we get. I'll talk for about 10 minutes, then I'll turn it over to each of the speakers who will have 15 each, and then we'll have hopefully a lively 20 minutes of Q&A, and I'll try to field those questions. So again, I'm Ann Anderson, and I work here at the University of Washington, and I'm the Associate Vice President and Controller, and also among many of the hats I wear, I'm also the leader of our UW Global Support Project. Kate Riley, who works with me, will present that model to you as part of her remarks. I'm going to introduce our speakers, and then I'm going to go right into giving you a bit about a survey that we conducted of the membership last spring. So, to my immediate right here is Kate Riley, who is the project manager at the University of Washington for our Global Support Project. I'm not going to go into their bios that are in the book. You can read those. So I'm just going to be very brief and tell you their titles and where they came from. To her right is Ann Bax. Ann is the Associate Director for Finance and Administration at the Duke Global Health Initiative. To her right is Donna Gallagher, who's the co-director of UMass at Worcester, right, Donna?
Yes.
Medical School, the Office of Global Health. And to her right is Mary Lee, who's the Associate Provost at Tufts University. So we're very fortunate to have a lively group of presenters who I think what you're going to hear are going to each present a slightly different take on how one might go about supporting international research and teaching, which I think is what this is all about. So I'm going to talk a little bit about the survey that we did last spring, and then I'll sort of set the tone and then turn things over to Kate. As part of our getting ready, if you will, for the conference, we thought that it would be useful for us to sort of take the pulse of the global health membership out in CUGH land. So the first disclaimer that so the first disclaimer I'll make is that, as most of you have learned through the day, the membership of CUGH just in the last 4 to 6 to 8 weeks has exploded. So the results that we're going to share with you today could potentially be slightly different than what we learned in the spring, but I don't think so. I think the trends that we heard from people are probably as true today as they were last spring when we asked the first 23 institutions. The other disclaimer that I'll make is one of the challenges that we have in CUGH is trying to get it, and you probably have this on your own campus as well, how do we get into the front door of global health, if you will? So what I mean by that is, for the purpose of this survey, we talked with who the member was that is representing that institution in CUGH. In some cases, that person has a small little bit of global health activity on that campus, and is a very teeny tiny office. And in some cases, we talked with the big hoo-ha department at that institution, and so the feedback that we might have gotten could be slightly different. And as the membership matures and the organization matures, we'll probably be able to get a much better sense of who's on point at particular institutions for all of the global health activity, if you will. So with those disclaimers, I'll tell you what we learned, and I'm going to do this very briefly because you got a handout. So what we tried to do is what we heard last year at the first annual meeting is that people wanted to get a sense of how global health institutes, centers, departments, units, the two people that seem to do this at our campus kind of thing, how they're organized. And so one part of the survey, and thanks to those of you that participated with us in gathering this data, we tried to get some sense of the demographics of the institution. So that data is in there. We tried to identify some best practices in administrative support. I'll come back to what we mean by that as I set the table for our speakers today. And then what were the greatest needs? What we learned in the inaugural meeting of the CUGH, which was 3 years ago, and I think Ann and I were there, and maybe 1 or 2 others of you, but it was a much smaller group than the 850 we have here this week. What we learned was that there's a tremendous gap, quite honestly, in university administration in supporting international activities. And that just isn't about global health. It's about anything international. There's little bits of help, little bits of services, but nothing that's comprehensive. Yeah. Okay, I got 5 minutes left. We did this by phone because we thought it would be much better than doing a Catalyst survey or something online. We had 88% participation. So, our findings, and then I'm going to move on to setting the table for our session this afternoon. Small units, more than the larger ones, have the greatest challenges, probably because there's not as much economies of scale, or in some cases they just don't know who to ask for the help that they need. As functions broaden, the risk expands. So if you have a little tiny operation abroad, your risks of the kinds of things that you're engaging in are much narrower and much smaller than the big, large-scale, complex operations where you're hiring and firing and leasing space and all that kind of thing. We're going to talk about that some more. What we find is sort of a trend is that people like me, and I live in the central administration of the university. I'm not out in the Department of Global Health or in Arts and Sciences or Sciences and Letters or however you call your campus units. I'm in the central administration. Sometimes people that think like me have a hard time translating what I do to an international context to be effective. And what we try to tell people in our organization, and Kate will talk more about this, is that if you do that, you're dead. You can't. You have to be able to think differently, and that's kind of what we've been hearing all morning today. That it is multidisciplinary, which is no surprise. Global health is what I like to say is interdisciplinary on steroids. Much of the interdisciplinary work that we do on our campuses is because we like it, because it's good, it makes for better results. In global health activity and global health research in particular, it's necessary, it's critical, it won't happen. So it's no surprise that on the administrative side you have to do that as well. And we learned that very quickly, that if you're trying to solve a finance problem only, you may put yourself in legal jeopardy, or you may do something in the HR space. So all of those disciplines, if you will, have to come together. And it makes it a much more complicated, but much more rewarding process. And one of the things that we struggle with, and I think most others do as well, is that there isn't a common platform, if you will, for gathering data about what faculty and students are doing abroad. Undergraduates, yes, we do a good job because we kind of have to, knowing where they are and what they're doing and who they're with. But everybody else, including faculty and staff, not really good data out there for getting our hands around what everybody's doing. And everybody's kind of struggling with that. So the greatest needs, to share best practices, that's what we heard, that people want CUGH to help to fill that gap, to facilitate collaborations, to get those innovative solutions that we can all try to implement in some way, to try to scale our guidance and our tools to meet not only the smallest kind of operation, but those big ones as well. And then to create a list of people that would be willing to share information so that people can be tapped into it and it can really become a network. I think that's it for the survey, right? Okay, so before I turn it over to Kate, I'm going to set the table for you a little bit. There's plenty of seats in here. You'll have to come around here, don't be shy, and sit in here next to others. I'm sure we all
share the sandbox.
So I'm going to pick on one of the analogies that Melinda Gates talked about today. Imagine Coke tried to expand internationally. They had this great idea to link into entrepreneurs in the local community. Everybody hear that on the exchange thing today? And yet they kept bumping into this wall where they didn't know how to hire the people to do it, and they didn't know how to pay them. And even if they knew how to pay them, they didn't know how to get the money there to pay them. Well, that's what our researchers experience in some cases on a daily basis. You can imagine how quickly Coke would have expanded internationally if on a daily basis they were running into those kinds of roadblocks. So another analogy, you have a physician who has a great idea for how to better treat X, cancer, whatever. And all it would take is the development of this little device. Yet, they didn't have any way to collaborate with the people in engineering or any of the other disciplines. Those same kinds of challenges on the administrative side are the ones that the enabling systems of CUGH is attempting as we sort of evolve ourselves, or birth ourselves, if you will, to try to address, is to come to the recognition that to solve or to help our faculty and students do their work internationally, quite honestly, they are changing the world and we have to help them. We have to help them do that. So you're going to hear some different, Kate's being my timekeeper here.
You're 14 seconds over.
14 seconds. You're going to hear some different approaches today, and that was the whole idea. And so with that, I'll turn it over to Kate, and at the end, as I said, we'll have a robust Q&A. And basically the tone of the next session after this one, and then those sessions tomorrow, will help to build on that idea that this is interdisciplinary and that it requires very innovative thought.